Let's jump into first a new study revealed by UAB researchers. It's about the percentage of traffic deaths in Alabama during the pandemic from 2020 through 2022. Our Sedona Meadows spoke with them. And Sedona, what did you learn?
Well, Kanisha, I learned so much. Ultimately, these researchers found that although fewer people were on the roads during the pandemic, deadly crashes in Alabama increased by 26% over the past 3 years. As we drove through the streets during the COVID-19 pandemic, it wasn't uncommon to see fewer drivers out and about. And this very observation,
going along the interstates and the highways, that there weren't too many cars and it was easy to speed and get on down where you needed to be in a quick fashion,
sparked an idea for Dr. Russell Griffin, an associate professor in the Department of Epidemiology at UAB, who co-authored a study with Lindy Reynolds, a PhD student, on how the pandemic may have impacted traffic fatalities in Alabama.
We just want to see how the different components of mortality rate could change in relation to COVID.
They collected car accident data from 2020 through 2022 within the Alabama eCrash database,
which is the police accident reports,
and calculated
the number of collisions in Alabama and the number of injuries from those collisions, and also the number of fatalities from those collisions,
along with data from the Federal Highway Administration
to pull what's called vehicle miles traveled, or how many miles people drive total per year.
And comparing records from the years of 2017 through 2019, finding deadly crashes in Alabama increased by 26% from 2020 through 2022. Reynolds says this raises the question if there was an increase in risky driving behaviors over the course of the pandemic.
I found a few sources that said there was an increase in the lack of seatbelt use, higher number of driving under the influence of alcohol and or other substances, and a higher proportion of speeding violations over a total number of violations, which would suggest that there was an increase in risky driving behavior over the course of the pandemic. But we can't directly say that this is what's responsible for the increase. We just think that that could be an explanation.
This behavior being something Dr. Griffin refers to as the theory of risk compensation,
where people think that if the chances of something bad happening are lower, they're going to take more risks.
And although this study focused on the period of the pandemic, it's not really a COVID study.
What we're looking at is this drastic change in traffic patterns and how that affects mortality rate.
Dr. Griffin says this type of research could help with the planning for emergency and medical services whenever such an event occurs. Yeah, and Dr. Griffin and Reynolds are currently completing a similar study with national data, working closely with the Association for the Advancement of Automobile Medicine. Back to you, Kanisha.